Hey everybody, it's Professor Wells. We're going to go over chapter 19, which goes over preventative and corrective oral appliances. Okay, so a number of appliances are available to prevent damage to teeth, keep them from shifting, prevent sleep apnea, and to orthodontically move teeth. Dental assistants and hygienists may be called upon to fabricate these appliances or to instruct patients in their use and home care. Most of these can be fabricated in the office. Sports mouth guards are used to protect teeth and their supporting structures from injuries due to sports activities. Mouth guards for sports come in three basic types: stock guards, boil and bite guards, and custom fit guards. Stock guards are purchased over the counter. They come in small, medium, and large and are the least expensive of the three. They also have the poorest fit. This makes the guards uncomfortable to wear and provide the least amount of protection. Boil and bite guards are purchased over the counter. The material is a thermoplastic and molds to the shape of the person's mouth and teeth when boiled in hot water. They may be difficult to mold for an inexperienced person, and they have a poor fit, but they're usually better than the stock guards. Custom fit guards are professionally made from cast of the patient's mouth. Due to the steps and materials used to fabricate a custom fit guard, they may cost several times more than the stock or boil and bite guards, but they also fit much better and are more durable. Sports guards can absorb about 80% of the energy from a traumatic hit to the mouth. They usually cover the upper teeth, gingiva, and bone. On occasion, they're made to cover both arches at the same time. Sports guards need a certain thickness and stiffness to maximize their protective qualities. So this figure here shows an injury to the lip and teeth that could have been avoided with a sports guard. And then figure B shows a multi-layer sports guard. That looks like it hurts, doesn't it? And just a little side note too, I know this says that the custom fit guards are the more expensive of the three. However, if you think about it, those stock guards and the boil and bite guards, a lot of times patients end up having to buy multiple of them because 1, they lose it, 2, the dog gets it, 3, it just isn't fitting right, so they want to redo it. So if you add up the amount of money they spent on purchasing multiple stock or boil and bite guards, they probably could have paid for a custom fit one. So sometimes it's easier to put things in perspective that way for the patient, and then they're more likely to comply with the treatment. Night guards are mainly worn at night to protect the teeth from clenching and grinding. Patients who grind their teeth do so mostly at night while they're sleeping. Common signs of chronic bruxing include wear facets, chipping and wear of incisal edges, stress cracks in the teeth, fractured cusps, cracked teeth, mobility of teeth, and large masseter muscles and sore muscles of mastication. Night guards are professionally made from cast of the patient's mouth. They do not prevent grinding, but protect the teeth from wear, chipping, and even fracture. So these are pretty much made the same way that we make whitening trays, but they're not cut as precisely as the whitening trays. So this figure shows a laboratory processed hard acrylic occlusal guard. And then figure B, this shows a soft guard made from thermoplastic material. And these kind of night guards are more comfortable for the patient. So this is the hard acrylic one, and this is the soft one. You can't really tell a difference from the picture. That's something where you would actually have to touch it in order to notice. But like I said, the soft ones are more comfortable. The hard ones, not so much, but they still do a great job. Hard acrylic guards should be used on patients who grind their teeth heavily and frequently. Hard acrylic guards are usually fabricated in a dental laboratory and take more chair time to adjust when delivering to the patient. Soft guards are better suited for patients who do not grind their teeth heavily and may not grind their teeth every day. Soft guards are made from soft thermoplastic sheets and can be fabricated in the dental office. They also take less chair time to adjust when delivering to the patient. Hard and soft thermoplastic materials are available for patients who need a hard occlusal surface for durability, but like the feel of the soft material. Most night guards and TMJ splints cover the maxillary teeth, but some dentists have guards fabricated to cover the mandibular teeth. There are also designs which only cover anterior teeth, which are called NTI splints, and some that cover the full dentition. So a lot of times we only make the upper guards because if a lot of patients, when they have something covering their lower teeth, in their sleep, their tongue can get under it and flip it out. So they're not able to use it properly. And it's not any fault of their own. It's just the tongue feels a foreign body in the mouth and it's trying to get it out. So it's pretty common. But that's why we keep it on the top, because the tongue kind of stays away from the upper arch. The hygienist and assistant should instruct the patient in the proper home care of the guard. The guard should be cleaned every day. If the guard is placed in a sealed container while still moist, this may promote the growth of bacteria and mold. Solutions containing alcohol, such as mouthwash or bleach, should not be used because they'll degrade the material. Commercially available soaks for orthodontic retainers or dentures are used to freshen the hard guard, but can degrade the soft polyvinyl acetate polyethylene guards over time. Patients should be advised not to immerse their sports guard or night guards in hot water because this can cause distortion. The mouth guard should be cleaned daily by rinsing thoroughly and then brushed with a toothbrush or denture brush with liquid soap, not toothpaste because of the abrasives in it. After rinsing the soap off, it should be stored in a container that is left open so it can air dry. If it's left moist, it can inhibit the growth of bacteria and mold. So it's not, you can still brush it with a little bit of toothpaste. What I tell patients to do is in the morning when they brush their teeth, after they clean their toothbrush off, after brushing, there's still probably just a little bit of toothpaste in the bristles. Brush it then. But you don't want to put a big glob of toothpaste on the toothbrush and use that to clean the mouth guard because it will cause those fine little scratches in it, and that's just going to let bacteria hide in those areas, and that's going to cause bacterial growth and mold. Snoring and obstructive sleep apnea are often caused by the relaxation of the muscles that support the soft palate, uvula, and tongue, causing a narrowing or closing of the airway. The most serious potential problems with OSA include hypertension, heart attack, heart failure, and stroke. Risk factors for OSA include a large neck, obesity, chronic nasal congestion, high blood pressure, diabetes, smoking, alcohol use, and a narrow airway. Men are twice as likely to have OSA than women. Treatment for mild OSA include weight loss, exercise, reduced alcohol intake, smoking cessation, sleeping on the side, and the use of nasal decongestants. Treatment for more severe OSA may involve the use of continuous positive airway pressure, like a CPAP machine. Most appliances do one of three things. 1, it lifts the soft palate. 2, holds the tongue in a more forward position. Or 3, repositions the mandible forward to bring the tongue away from the airway. And this figure shows a continuous positive airway pressure, a CPAP device for obstructive sleep apnea. Used most frequently in pediatric dentistry when a tooth is lost too soon. The space maintainer keeps the adjacent teeth from moving into the open spot and maintains a space for the permanent tooth to erupt into. Space maintainers may be used on adults to maintain the space for an implant as well. They can be removable or fixed. A removable space maintainer may be in the form of a stay plate or a retainer with a denture tooth or acrylic block attached. So one of these pictures, this figure shows a fixed space maintainer here. And then this is a Holly device. It's an appliance with a labial bow. So this goes around the front of the teeth here. And you can see right here the labial bow. And that's activated by tightening these loops here. So that can keep the teeth in place. Recent orthodontic tooth aligners like Invisalign or Sure Smile are clear thermoplastic aligners used to gradually move the teeth into the desired position. They're used more with adults than children and are popular because they're more aesthetic than conventional braces. Design software creates a three-dimensional model from a digital scan or a cast of the teeth. A dental tech uses the image to move the individual teeth into the final desired position using design software. The software simulates the teeth moving in gradual stages, and the aligners are made for each stage of movement. The patient wears the aligners approximately 20 hours a day. The aligners are only removed to eat, drink, or to clean the teeth. A new aligner in the series is used every 2 to 4 weeks. So oral guards are used for multiple reasons within the dental field to protect the dentition and health of the patient. It's important for the clinician to be able to answer questions about the procedures and materials used to make the guards. So we will be making, we may have the opportunity to make our mouth guard in class. I have to make sure we have the material. But if you guys happen to have any questions over any of this material, please reach out to me. My email is hwells14@ivtech.edu.